Across the country, people are refusing to eat their vegetables. They're worried about Cyclospora, the outbreak that is causing all sorts of gastrointestinal symptoms. We won't go into them exactly. Since May, there have been more than 1,600 confirmed cases. You see the map there, all bright red. And the CDC is investigating more than 5,100 cases across 34 states. Officials are looking closely at a large cluster in the Midwest. Meanwhile, the Trump administration is facing criticism over last year's cuts to public health funding and changes to the CDC foodborne illness surveillance programs, which some public health experts say may have slowed down the outbreak detection in this case. Joining us now, MS Now senior medical analyst, Dr. Vin Gupta. You know, Doc, I was watching your video about this. It was really informative. There have been outbreaks like this in the past, but why do you feel that this time is different?
Ariel, good afternoon. You know, this time it's different because there has been a direct cut of the team, the foodborne disease surveillance team at the CDC, both in terms of staff, just how many people are doing this work, this really vital work, making sure food supply is safe, it doesn't have infectious diseases associated with it, and then also doing testing. And we're testing for a smaller number of diseases now that might be detected, and we don't have enough people. And so what ends up happening is we're seeing caseloads, Ariel, 10 to 20 times higher than typical. You know, we commonly see Cyclospora, which is a parasite, spike in the summers, but we're seeing levels 10 to 20 times higher, in part, and we think largely driven by the fact that not enough people, not enough resources doing this vital work.
And at least 34 states, as we mentioned, have reported those cases. You have said, I think it was in your video, that a number of these cases is probably far higher than what we even know about. How difficult is it for health authorities to pinpoint the source of the outbreak?
Well, in this case, Cyclospora, which is a microscopic parasite, it can infect the intestinal lining, cause symptoms that, as you rightly pointed out, I'll avoid talking about in detail. But it causes significant GI upset. But here's the complication, Ariel, is symptoms can begin anywhere from 2 days to 2 weeks after you eat, say, infected lettuce or cilantro that might be infected or a piece of fruit. And so a lot of people can't pinpoint, because there's such a lag time between eating something that might have caused the problem in the first place and the incubation period is 2 days to 2 weeks. So that's the problem, is tracing that.
Yet another reason why I do not eat cilantro. How, in all seriousness, though, this is incredibly uncomfortable if it's contracted. Is it dangerous, and how can it be treated?
For sure. So, we have some actionable tips here, and I'll try to summarize it quickly. What should you do? This is the question I'm getting endlessly from all folks. What can you do to protect yourself? One, do you have to avoid salad? Answer is no, you do not need to avoid salad, but I would avoid bagged salads. And when it comes to produce, if you can peel it, that's always preferred. So if you can peel the produce and avoiding bag salads, that's great. If you are medically higher risk, if you're on an immunocompromising medication, if you say are getting dialysis, if you're older than 65, if you're pregnant, just some examples, I would cook your spinach, not eat it raw. And so if you can cook your leafy greens, that is preferred until, Ariel, this is not forever, until we find out what's going on. Where in our supply is this outbreak originating from? And lastly, to answer your question, if you're medically higher risk, have had symptoms for a few days, can't keep anything down, you're at risk for dehydration, that is concerning. Don't assume this is a normal stomach bug. Seek medical attention. There's an antibiotic, common antibiotic that can treat this, but early treatment always preferred.
Critical advice there, Doc. How likely is it that this outbreak gets worse, and how prepared do you believe, given the concerns that you voiced about the CDC's surveillance program, how prepared are officials to try to curb this?
Doesn't seem like they're very prepared, because resources are dramatically lower than they ever were, say, at the peak of the pandemic. But, over the last 5 years, resources at the local and state public health department level are bare. They're barely existing when it comes to foodborne disease surveillance efforts. And so I'm concerned about that, not just for now, but over the medium to long term. This is stuff that we have to invest in, one. And I do think it's going to get worse before it gets better. It's going to only get hotter. This parasite thrives in warmer temperatures. And, but we're talking about it more. We're norming that we need to be taking these proactive efforts amongst the general public. And so I'm hoping that people are just more thoughtful in the grocery store and more thoughtful in the kitchen when it comes to how they can avoid exposure.
cook and wash your veggies, at least for now. Dr. Vin Gupta, thank you as always for your insights. Appreciate you.
Thank you.